we can do more with sewing up cuts and
X-rays.
But from what
Yeah, an
Dad
X-ray,
said,
yeah.
even at care here, he's not seeing you on the level as a doctor for primary care. He's seeing you on the same level that you're getting at Maury Regional.
Right.
So you're still getting the same care, but from a doctor.
4 hours a week.
But he's not looking at you as a doctor.
As a primary care physician.
If you've got
Right.
something that's more serious,
Even-
you're gonna go to a specialist for that.
I understand that, but I think their thing is at least they're getting to see a doctor. I think is their thing. They won't be seeing a nurse practitioner. It don't have to be their primary care provider. That at that moment, at that appointment, they're getting to see a doctor.
And that's for the people that don't have doctors, is that what you're saying?
Right.
Yeah, it's more of a comfort, I think it's more of a comfort
Yep.
thing.
Just because of the initials at the end being different.
Yeah,
Yeah.
it's just a comfort thing.
if they really feel that they need to see a physician, then if that's a comfort issue and real important to them, then they need to go see a physician.
And it takes money for a lot of them.
So what would be the process? This would be an example. A pre-existing condition may be high blood pressure. Okay, somebody's at work and they get a real bad headache or whatever, and they feel, all right, let me check your blood pressure's up. So they go out here to the walk-in clinic. It's a pre-existing condition or on medication or whatever. What can the urgent care do for them? Can they prescribe them blood pressure medicine, or do they say, hey, you just need to go see your primary care physician? I mean, what would be the process there?
So there's a couple of scenarios to that.
Okay.
So let's kind of talk through both of them. If your blood pressure is at stroke level,
That's an emergency.
that's an emergency.
Okay.
And we're going to say we're going to help you facilitate your entrance into the emergency department.
Okay.
Okay? If your blood pressure is high and you're a known hypertensive patient, there are some medications that we keep on hand that we can give you in the clinic to try to lower your pressure. If those don't work and your pressure continues to stay there, then that's probably going to be a referral to the ED. If those help your pressure and you already have a primary care physician, then we're probably going to facilitate you a quick referral into your primary care physician, but get you enough medication to say, take this medication if your blood pressure goes up again before you get to your primary care provider. So that's a couple different scenarios. Unfortunately, nothing in medicine is cookie cutter. You being in security, you know that over there. So every situation is different, but we are trying to provide the biggest scope of care that we can for the city employees and their dependents.
And how would the care here clinic have handled that any different from what she's saying Maury Regional Urgent Care would have handled that same situation?
Well, I would hope that they would, anybody that's in the stroke condition, they would just automatically call an ambulance and get them to the hospital. But I don't know really what their process is, and I don't even know if they would have drugs on hand that can.
Well, my hope is, okay, let's say we've got your employee who's really concerned about, I want to see a physician, or about the expense, the personal expense. Okay. Well, right now, if he's really worried about that personal expense and he doesn't want to spend the money, doesn't have the money or whatever, he can only go these hours that they're open. Okay. Well, what if it is really serious and he doesn't go and it turns into a stroke or a heart attack? Okay. Now he will have somewhere he can go 7 days a week, no cost to him, and be seen. I mean, the extended hours of access is the biggest, most important thing we're talking about here. I mean, the ability to go at no expense to them on all those expanded hours. I hope that it doesn't happen, but likely we'll save somebody's life because now they won't feel that bad, like I can't afford to go. Now they have somewhere they can go.
Well, I think our employees are utilizing the clinic. They love the clinic.
Well, this year, we only had 92% usage of the clinic on those 12 hours a week. And, 162 or 69 or something of those were for HRAs. So I really question how much our employees are actually using the clinic.
If,
They say they do, I don't
Yeah.
know.
if the
I think you have some that use it a lot and are real happy.
If the personal touch is an issue for some, 'cause I mean, I know, I like, when I go somewhere, I like to see the same person. I mean, I'm like that. So I noticed no appointment needed. Can the employees schedule an appointment and always see the same provider? Yes, they're not a doctor like what you're getting at Care Here, but can you still always, when you go in, see the same person?
So that is typically right now, we don't advertise what provider's on duty. And I would need to talk through that. I don't see that that's a huge issue. Most of them, if you need to follow up in 3 months, will be like, okay, their schedule's not out that far in advance, but, you know, they can say call in a month and just say, I want to come when Patrick's working. I don't see that being a huge barrier.
I would not count on that, though. I mean, honestly. The ability to staff something like that 7 days a week requires that you have a whole lot of, I mean, I always want to see the same policeman, whether it's Sunday morning or you know. You can't do it that way, you know? I mean,
Too many
the way,
factors
to
in there.
staff those hours, you've got to have a broad base of employees that do
But
it.
could you call ahead to say?
So we
is
have,
so-and-so working?
well, that's not gonna probably be the question to ask. When you call the ER, don't ask that question. We have 4 full-time providers that are there. So the odds of you not, there will never be a day that one of the 4 full-time providers is not there. If you're coming back in for a follow-up on something we've seen you for, then certainly it shouldn't be an issue to get you on with that provider, given the fact that they're not on vacation for 2 weeks. But if you're calling that morning because you got a cough and you want to know Patrick's working today, that's probably not.
Yeah.
And it's not the best thing for you to do either. Because at the end of the day, you don't need to wait for Patrick to be on to be seen for a cough that could turn into something bigger like bronchitis or pneumonia.
Right.
But if it's a follow-up on something that Patrick saw you for before, I don't think that's an issue when you leave to get back on their schedule. But if you have a event going on right then, we have the best, I mean, I'll say I have really good providers there. They've caught a couple things for me along the way. So I have full faith in all of them, including our PRN staff. But we typically try to staff 2 full-time providers on every shift unless somebody's on vacation. So, and we are fully staffed with 4 full-time providers.
And they're gonna do their best for anybody that comes in there, and they're not gonna just say, you know, I mean, you're gonna get very good care I would say 99% of the time you go, any doctor or nurse practitioner, you're gonna get the best care you can get out of that person. Even though first time you've ever seen them, or it's the 10th time you've ever seen them, they're still gonna care for you like they hopefully should, so.
And they will all have access to your record. And like I said, their medical director is accessible to them anytime the clinic is open.
So if they see something, they're like, I'm not sure, they have a doctor they can get a hold of. to ask the
And
question.
they plan on doing employee surveys to see
Yeah.
what's working
Yes.
and not working.
Yeah.
So we want your employees' feedback because we want to make this,
And let's be clear, there will
The
be
best-
growing pains. We don't walk in here with something that was starting the first time and it's perfect, you know.
but we want that feedback and that opportunity to make it the best it can be for them.
Let me ask you this, can you make an appointment?
You can.
Or is it walk-in only?
You can make an appointment if you choose.
You're just not making an appointment with a certain person.
Correct.
Will it be online, make an appointment, or will it be a phone call?
Not yet. I don't have the ability to make it where you can schedule appointments for urgent care through the patient portal yet. Hopefully that will be coming. I've asked for it in the second phase of the medical
Yeah.
record system, which is probably.
Yeah, we don't want to make any promises on
No.
that at this point. We're still
So
working. from
we've
the first
asked,
phase.
we've not been told, so right now you have to you
And
do
that
have to
was
make a
one
phone
of the
call.
other gripes I had with Care Here was, when I did that one time try to use it, I called and I spoke with somebody in like Tulsa or something. It wasn't even like somebody in Columbia or something. It really ticked me off, but Anyway.
You're gonna speak to people in
Yeah.
Columbia when
Yeah,
you call.
so that, you know, the people that use it now, they're comfortable with it, and that's where that's why we're having
Yeah.
the employees, and the people that voice their opinions are people up in their upper forties and fifties, the ones that are getting to the fact, well, they have to go get blood pressure medicines and, you know, stuff like that, because they are getting older in age. People like my age, I'm 35, and I'm right there on the edge of, I'm probably gonna have to start doing that, but you got the younger employees that they're probably not gonna do it, or they're still on mom and dad's insurance or whatever, but they're just comfortable with it, and that's where all the gripes come from, I think, is that's what they're used to. And now we're about to change, and that makes them mad. So the best thing to do is just what, you know, that's what we're here for, is to go and try to smooth them back down and say, you're gonna get the same thing.
You're gonna get more.
You're getting a little more, and it's open more for you, you know, so.
Well, so in the discussion we were having just now, the overriding thing that I hear is the continuity of care, okay? And, you know, when you go to Care Here now, Care Here has its own medical record that if you go there and you need to go to a primary care physician or somewhere else, that doesn't follow them. We will all be on the same medical record. The next point on our list is referrals, okay? So right now, if you've gone to Care Here, you have to be referred, you may be referred elsewhere to a specialist, or you may be referred to a Maury Regional specialist by them. When you come to us, you might be referred within our system or outside of our system, that could happen. But if you're within our system, which we have a tremendous amount of specialists on the same system, they're going to see all that data right there. They're going to see your information in there. So your continuity of care will be greatly enhanced.
I got an email, I'm sure everybody else got it, from Sergeant Tom Gray, wanting to know, he couldn't be here today, but he asked somebody to ask the question, what's in the comprehensive report given to HR following your screening?
I think that was the question. I think you addressed that earlier.
Yeah.
It was
So-
the follow-up with the phone calls, that's when,
Yeah.
it's more, I guess it's more of statistics saying,
That's
you
what
have
it is.
so many employees
So,
that are.
if I hear your question right, tell me if I hear this right, and then I'll answer it. So the question is, what are we giving on what was screened beyond the individual? What are we reporting back
To HR.
to HR? Okay, so that won't be any different than when we've done screenings in the past for y'all, okay? We will talk about the big picture. So the way that data is gathered is like, well, I could sit down and say you had X percentage that had high blood pressure, and you had X percentage that was, you know, whatever level they were on blood pressure or blood sugar. We will not, cannot, and would be a federal offense if we did tell his individual information to HR. I am not going to federal prison over this. It is, we do not share individuals' information. The way we will give the data is we've done in the past, is it will show, you know, categories like blood pressure, blood sugar, obesity, hypertension, whatever, all those things. But then it elevates up into 4 key disease states that drive healthcare costs, okay? Heart disease, diabetes, emotional health. I can't think of the 4th one off the top of my head, but so we'll talk about, you've got these with these big picture things going on, X percentage, okay? And then actually goes up, so I call that's like 30,000 feet looking at the health of your population. And then it goes to another level, which is like 90,000 feet looking at your health population, which is your biometric screenings. So here's where you're kind of rated as a population of your screening numbers. Here's where you're rated as the whole health of your population. And that's all about trying to figure out what can we do to improve the health of the broader population, okay? And I anticipate we'll build some programs around what we see from that. I mean, the data we have now is old, So we gotta get through a year of doing that. So, probably between July and December, we'll get all those done, and then we'll see what our data is, and then we'll sit down and say, here's what we see. You've got X percent that have heart disease risk. You have X percent that have diabetes risk. But I'm not saying Sergeant John Doe has this risk.
And we're actually receiving that same information from Blue Cross now. It's just that you're not aware of it because we didn't say, we're getting our mid-year report from Blue Cross and it shows
Yeah.
our overall health, And,
Yeah.
and I did want to say that I did respond to Tony Gray and didn't hear anything back from him after I responded, so,
Yeah.
Could you-
So anyway, we are not giving out anybody's individual information. Okay. The next point on here is location, all right? So current state, care here is located in North Columbia. Future state is urgent care is located in the center of Columbia, right next to the hospital. I would argue we're more centrally located, a little closer to the majority of your employees than that site. But it's almost a wash. I mean, they're both in the city limits. One's at that end of town and one's in the middle of town.
Question. Different Maury Regional little outposts, like Mount Pleasant, right there on South Cross
Mhm.
Bridges, there's one in Spring Hill.
Yeah.
Can an employee go there and get almost the same thing? Maybe nothing similar to that at all?
Currently, this agreement is just for the Columbia site.
Okay.
Yeah, so you cannot use this program at any other site except urgent care
Okay.
on campus. There may be a point that we do that, particularly in Spring Hill, and have two sites. We've got some things that we're looking at, but I don't know whether they'll materialize or not.
Okay.
But this is for this site, okay?
Okay.
1218 Trotwood Avenue, if you pull on campus, it's got a giant C on the building, Building C.
I have a
Uh,
question about the fast tracking. We send guys over there for workers' comp. Will they be fast tracked for workers' comp or do they wait?
They will be fast-tracked as work comp.
Okay,
That falls under this agreement now.
okay.
As far as cost savings, these are Connie's numbers. You may want to speak to those numbers, and then I'll talk a little broader
The
about
way
it.
we did a comparison was, I took all the costs from the Care Here year-end report for the nurse practitioner, the nurse, and the doctor, plus all the medications and everything that we've spent inside the clinic to get a number. And then I spoke to Don and Patrick and asked them, because it's a completely different system, the way Care Here bills us. They bill us like $23 a month for each employee just to use their records and I don't know what else, but $23 a month, and they don't do that. And then we pay for the doctors. We don't do that with them. So in order to sort of get an apples to apples as much as we could, we took the actual costs associated with operating the clinic, and then I asked them, and off of their list of charges, they had basically a low, a mid, and a high level of office visits, and they say that most of our visits will be low or medium, so I calculated the amount of people, the amount of visits that Care Here had at the medium rate, and that's how we got that calculation.
So is that,
And then I just added in the generic drugs that Blue Cross gave us the estimate, which was like $22,000 to cover all the generics that they have covered.
so even though I didn't go to Care Here, you still had to pay $23?
Yeah, let me talk to the
That's
difference
crazy.
of the difference of methodology. So today, when Care Here is out there and nobody's there, the city's paying them if it's being used or not. And paying to rent the site and paying utilities, okay? And paying per covered life on a monthly basis of $23 or whatever it is. Whether you ever use it or not, you're paying for it whether you don't. With us, if you don't use us, we don't charge you anything. If you use us, We charge it for whatever that was that we saw at a very good rate. We have a very excellent pricing on what this has done. Now, in all honesty, the comparison Connie has is what they did at Care Here and the amount we did. We're talking about 7 days a week. We're gonna see a lot more people, okay? So the cost will be probably different because we're gonna be doing a whole lot more and a whole lot more procedures that they can't do. But,
But you're not wasting money on somebody that's not just sitting around not
yeah,
using it.
yeah, you're only paying for what you use.
Mhm.
Okay, I mean, it is as transparent in what you're paying for as it can be. If they come and get it done, that's what we charge for. If nobody ever comes, city won't pay a penny. If your employees don't like it at all and they never come, it won't cost you anything. If they love it, they come a lot, well, then we'll charge you per time. But if you look at the big picture, if they're coming and they're seeing this, and then we're getting them a blood pressure medicine, then we're controlling their blood sugar, and we keep them from having to go to the ER to get stitched up, we're gonna save you a whole lot more money in the big picture.
And
Okay.
none of that is hitting our Blue Cross claims account, so hopefully those claims will either reduce or stay level or.
Well, and in managing the health of your employees, the city has very low turnover of employees compared to most employers. Your employees, they hire on here and they stay a long time. Okay. Well, generally speaking. So if they have a disease state, y'all own that already. I mean, most of them, if you've got a lot of heart disease or diabetes that we've identified coming down the pike, you're going to be paying for that. Me as a taxpayer am going to be paying for that through my taxes, okay? But hopefully by having a program that we're getting them in, there's no barriers, they can get in more hours, we're helping manage it better. They're not going to go to the ER, and instead of it being a, $300 charge or a $60 charge, whatever it is, or 30, whatever it is from us, hopefully it'll be that instead of a, $1,500 charge or whatever from the ED. Hopefully we'll get you on blood pressure medicine that now you're taking because it doesn't cost you anything and you're doing it. And then you're not going to have that $50,000 heart surgery down the road. Not to mention that maybe you'll be around. So, the big picture is to try to improve the health of your population. So anyway, those are all the points. Any other questions?
I got a question that was, had asked to me, what about the maintenance medications, like BP meds and thyroid, cholesterol, et cetera? Would those scripts have to be written from the urgent care clinic to be free?
Yes.
Diabetic.
They will?
If
Well-
they're generic, do they have to be written from the urgent care clinic? Okay.
Okay.
What about insulin?
If it's-
If it's generic, then it's covered under your generic plan. Some insulins are not generic, unfortunately, and that cost is on the rise if you just listen to the news in the last few days.
Is the A1C lab work that's required every 3 months paid for?
It's in this agreement. In this agreement.
So Connie,
It is definitely in our interest to help you manage your diabetes.
Absolutely.
It's in your interest more than anybody's. But it's in the city's interest, and that's what we're trying to help do.
And we're trying to give you an expedited avenue to do that.
so if our physician writes, if we're on maintenance blood pressure and our physician writes us a prescription, can we not take it to,
It has to
Okay.
be, it has to be from them.
well, right now we can do that. Right now the care clinic does that. If we have if we're on BP.
Yeah,
we
but
can-
you're paying for it.
Okay.
So the only way it can be a zero copay is if it comes from the clinic.
Which would just be just a first visit, and then I guess they would say, you would say, hey, this is what I'm on, and they would give you the generic form of it.
You check
Is
in
that-
with you and see how you're doing, what's going
Is that
on.
pretty much it? Just to get whoever that person is
Yeah.
back on
It would
track
be
of kind of being.
for us to get your history and
Right.
establish and all those things to get that done.
So the clinic could get on board to do that.
Mhm.
And we would be, then our blood pressure medicine or whatever would be
You would have to come to get that prescription from them.
from them.
But typically, I don't know who your primary care is. If they're one of our primary care, we're gonna see that in your record.
And they're, back to your point about seeing a doctor, okay? there's likely to be those that come through that have high A1C or whatever, that we're like, to maintain this, we're not the right avenue to really manage your health. You really do need to be with an endocrinologist, or you really need a primary care that's on top of this with you. There's gonna be conversations that go on like that, and they're going, well, I don't wanna have to pay for it. It's like, well, you can keep coming here, but you will be better served to have somebody else do that, where you do see the same doctor every time. There's definitely a place for that, absolutely. We're not trying to take away from that.
I spoke for my department most of the meeting, but, I've been here a really long time, and I feel like the clinic is probably one of the best benefits city employees has ever been given. I know it is in 21 years. And when I first heard rumblings that the clinic may be closing, I thought, man, that's awful, and then when they come up and say, well, no, we're not closing, we're gonna give you an alternative and a better alternative. I'm for one extremely grateful, and I think I speak for a lot. There was just a lot of people that have questions.
Well, change is hard.
Change is hard.
Yeah.
But I think it's a wonderful benefit the city
Well,
provides their
and
employees.
let
And the
me-
employees are grateful.
Let me say one point too, as far as, I don't want anybody, I don't care who their employer is, I don't want them to lose their job. I'm not trying to cause the people that work at this place to lose their job. I'm trying to offer a better benefit. But I would tell those folks, we have openings every day at the hospital. If they are trained medical professionals, look at our website and see, and if they live in Columbia, Maury County, or this region, because we're a regional provider, tell them to look there and apply. We'd love for them to be on our team.
Oh, I'm not talking about out there, I'm talking about employees, I'm not talking about the employees at the clinic. I don't know anything about that.
Well, I've had some
We've had
comments
some
about
concerns.
them losing their jobs, and I don't want them to lose their jobs. But first of all, they work for Care Here. Maybe Care Here has something somewhere else for them, and if not, we have openings every day, Matter of fact, Dawn, you've got a few places you'd really love to put some of them right now.
I have some openings,
Yeah.
yes.
Yeah.
To add to what he was saying though on the cost, whether he uses the Care Hair Clinic or not, it costs us every day. And Connie can give more detail on it, but I know some of the departments don't realize, Carolyn that cleans City Hall also goes to Care Here and cleans there. If the air goes out at Care Here or a light bulb needs changed, Johnny leaves here and goes to Care Here to handle their maintenance too. So in that cost, you are eliminating all of that because they have their own maintenance and they take care of their own. And I don't know, I think the air may have went out over the summer or something. I don't know if we had
Well,
to
the
pay
heat
that
just
bill
went out
or.
too.
So whatever, we pay rent for that office, so pretty much it's another city office, so we're paying rent. And then whatever's not covered under the lease agreement for that rent, the city is covering. And I don't know if Connie included that in her
No,
numbers.
this
but
is only, if you look at this, and some of those things, are soft costs that you really can't put a number on, but this was only the cost of operating the clinic. If we actually add in the rent for the clinic and the utilities that we've spent, it came to $52,000 or $54,000 savings a year.
Plus the time that Carolyn goes over, plus Johnny's time that he goes over that you couldn't get a number for.
$52,000 or $54,000 is a whole lot of visits to
Where-
our
where-
walk-in clinic.
Where does the number come from on y'all's cost right here?
I explained that. I used Care Here's information with, the number of people that they saw, the number of visits, and what it costs for our $23 a month admin fees, what it costs for the labor for the doctor, the nurse practitioner, and the nurse, and then any kind of supplies and drugs that we got for the clinic is included in that number, the 243 number. So then, to compare it to something somewhat comparable, I asked Dawn and Patrick, and I used a mid-level, the same amount of appointments, and came up with it.
So, I guess my question then is, you said if we don't visit y'all, y'all don't bill.
That's
So
right.
as far as our contract agreement, there's no flat out.
There's no
fee.
guarantee that anybody's gonna be coming or not coming. But
No,
I
no.
hope that you'll use it a lot more than you use Care Here, and
Well, there's no doubt it'll be used. I mean, you got the people that love the clinic, and if it's leaving and this is their alternative, they're gonna go to it, and like I said, after the initial change, they might like it better. I know that the time factor, the hours is the big thing, but you're saying if from day one, nobody ever walked through the door, the city pays nothing.
Correct. Pay zero.
yeah, we're not charging you rent or utilities or for the time that the physician or PA worked, or that the nurse worked, or for the lab work, or you get no charges if you don't use it. I mean, it is as transparent as I know how you can make it.
At the end of every month, Connie will get a bill, and it will show you had this many office visits, this many people had a CBC or a hemoglobin A1C, this many people had, you're paying for this many laceration repairs that
Yeah.
fall in this category. So when.
It won't list their name.
It won't. When she looks at that every month, she's gonna go, okay, then out of our, just pick a number, 500 covered lives, 250 of them, 250 of those went to the urgent care and sought treatment under this agreement. And they weren't in the ED or in their in another place that has a
And
higher
they did get on blood
cost.
pressure medicine and get their blood pressure under control
I
or
guess
whatever.
my biggest concern with the whole thing is, what you said a while ago, is we got these comparative prices here. Well, the bill we're gonna end up getting at the end of the month, because of the 5 times the hours, is gonna be a lot more than this.
But we're paying that anyway, Jeff, because if they're going to a regular doctor, we're paying it and we're paying a higher rate.
Well, they're
If
paying
going
out
to
of
the ER,
pocket first.
Yeah.
you know.
Well, if they don't like it, they can go somewhere else and pay out of pocket,
Yeah.
or they cannot come.
No, but what I'm saying is, I fear that if we swap to the urgent care, and I think it has a lot more benefits, that the bill that we're gonna incur at the end of the year
will be higher. We
will
know
be a
that.
lot higher, and then another year down the road, it may be, well, we can't afford to do this no more.
Well, the way we look at it is, we're gonna pay it one way or the other. Either through the claim processing with Blue Cross Blue Shield, or through this. And we prefer to pay it through this, where we get
It would cost the
A
city
better
less
rate.
to pay it through this versus pay it through.
If by paying it through our self-insurance program, we pay more. If we can divert people from our self-insurance program, you know, our Blue
No,
Cross
so
Blue
no
Shield.
matter what that bill gets to,
I
it's
mean,
still
we're
gonna
gonna
be
pay
cheaper.
for
Yeah.
Well, there's
healthcare,
only
somebody.
certain things that they can
And back
pay
to the
for.
whole, an ounce of prevention's worth a pound of cure. It's a whole lot cheaper to get you to come and take your blood pressure medicine than to pay for a heart
Hospital
attack.
stay with us.
Right.
Yeah.
But even, it's a lot cheaper to bring your sore throat through this program than it is to take it to your primary care physician and process it through Blue Cross Blue Shield.
Absolutely. So this is a savings. The more people use this,
Yeah.
the more the city will save.
I anticipate that Connie and her staff will be able to do a good job recruiting people to work for the city. This is a great benefit. I mean, we don't have anybody else that is saying, we want to make this broad